Good afternoon. Welcome to the R.U.A.C.H show. R.U.A.C.H is a Hebrew word which means spirit or breath of God. But today in our gathering here, it is religious understanding and community harmony. And we are gathered here with some religious leaders from our community to talk about a very important topic. Today we're talking about the opioid addiction community crisis. My name is John Nicketh. I'm the pastor of First Lutheran Church in Lynn, in Wyoming Square. I'd like my colleagues to introduce themselves to you as well.
Good to be here with you all today. I'm Reverend Jane Gould, and I am the pastor of St. Stephen's Episcopal Church here on the Common in Lynn.
Hello, I'm Rabbi Margie Klein-Ronkin, and I'm here with the Essex County Community Organization, which is based here in Lynn, and I also serve Congregation Sha'arei Shalom.
Good afternoon. Pleasure being here with you all. I am Reverend Andre Bennett, and I am the youth pastor at Zion Baptist Church behind Lynn English High School.
And this is Reverend Andre's first time on the panel today. So
it sure is. It sure is.
Welcome you.
Thank you. Thank you.
So we chose our topic, the title of our topic, very intentionally today when we said opioid addiction community crisis. Because sometimes I think when we talk about addiction, we have this tendency to think of it as a personal problem, something that I am struggling with or that you are struggling with, and that we don't often think about the impact that addiction has on the community beyond that person. And so before we even go into this, I think it'd be helpful just to take a step back and think about when someone is struggling with addiction, we know that it affects more than that person. And you probably all have experience in your context of seeing how that can play out in a family, in a congregation, in our community as a whole. So how big is this epidemic that we're talking about, and how do you see it affecting our community?
Well, I think I see it very much from two contexts. My primary context as a parish priest, I see it in the friends and family members and members of my congregation who are struggling with addiction, those who are coming to the AA and NA meetings in our building. And, you know, the number of people of all ages who will say, I'm going to a funeral this week for a young person who died of an overdose. But the other context where I know it is I'm the president of the board of the Lynn Community Health Center. And so at the health center, we have a number of medically assisted treatment programs for folks who are addicted. We deal with a lot of the struggles of our patients who are addicted and try to provide the primary care and behavioral health care that they need. And so I'm very conscious there also of the cost to our community in a different kind of way. And if you look at our statistics for so far in 2016, we've already had 348, 360 overdose calls to 911, which means there have been a lot more overdoses where folks didn't call 911, and 40 of them have been fatal overdoses. And what this means is we've already, 348, the first number, that was the 215 number for the year. So we have already significantly surpassed last year's overdose rate. The only good news in this story is that we have lowered the percent who die. And that's really because of the efforts of the Project COPE, Bridgewell, the health center, the primary responders, police and fire, and family members and friends gaining access to Narcan and really proactively intercepting overdoses. But numerically, we're seeing just skyrocketing numbers of not just addiction, but overdoses due to addiction. And it feels to me like every time you read the newspaper, they're talking about a new and worse opioid that's on its way to our community.
Absolutely. I'm wondering though, Reverend Jane, the numbers that you just gave us, 360 as against 348, 40 as against a lower number in terms of fatalities. The numbers for 2015, that was for the entire year, yes. Correct? And that what we have now for 2016 is up to this point, yeah. Right? So, yeah. You know, I don't even know if we can start celebrating yet that the number of fatalities.
No, it's only that the percent is down, right? The number will exceed last year's number of lives lost to addiction.
And it is a real concern. Like Reverend Jane, I serve a church here in Lynn, and I see addiction of all sorts. I think one of the things that I see more than anything else is those members, and oftentimes when we hear about addiction, we think of mainly young adults and middle-aged individuals. But I have, people who would be classified as seniors that have some kind of addiction where either prescription or illicit drugs is concerned, or alcohol. And it was very recently I was having a conversation with someone who is not yet a member of the church, but is on their way. And it's a matter of, it's not an addiction. That's the argument. I don't have an addiction. It's a coping thing. Even though I will do anything I need to do to get this thing to cope. You know what I mean? So there is no doubt in my mind that this is an epidemic that's severely damaging and affecting our communities.
Yeah, I think in terms of how big the problem is, there's so many layers to the problem. So, the problem is affecting the people who are getting addicted, of course, but then it's also affecting their whole families and, their jobs and their schools. And another thing that I've been thinking about working with all of you and others in the Essex County Community Organization, we've been thinking about what's going on in our jails. And our jails are filling up with people who are doing not great things in order to get the drugs that they want. And some of them, as you said, are legal, some are not. But addiction is fueling mass incarceration. So many people are getting locked up. And hopefully this will change soon, because I know it's something that all of the sheriff's candidates have been talking about. But we right now don't have treatment. So we're sending people who are addicted into a system where as soon as they get out, they're gonna, they haven't gone through treatment. And so it's, not that this is the biggest thing, but I mean, it's just sort of costing us, it's costing taxpayers money that we could be using for our schools or for so many other, for elder care, transportation. Instead, we're using to lock people up who we haven't figured out how to help.
Well, and also, like if you want to talk about some of the costs we might not think about, when you're talking about so far this year, 360 overdoses that were 911 calls, think about the first responders who have to go, like we're sending fire trucks and ambulances and police cars to every single one of those 911 calls. Those folks cannot be responding to something else. And so when you have these rates just going up by whopping percentages every year, they can't, people die if they ignore those 911 calls on overdoses. Absolutely, that's where we want them going and what we want them doing. And the fire, police, ambulance, EMT services in Lynn have been great in responding fast and effectively and all of that, but we all know there are other things that our city budget might want those folks free to be doing than responding to overdose calls.
And in addition to just the resource cost, there's a human cost on those people. I have a couple of ambulance drivers and social workers in my congregation,
Yes.
and they are wiped.
Yeah.
Like they personally responding to and seeing, people who are 18, 19 years old who are dead from an overdose, clients that they've been working with for months and months who they thought were doing okay, dying unexpectedly. And there's almost a kind of, I don't know if depression is the word, but a despair that can set in with these first responders who are on the front lines of this, because it doesn't seem to be letting up.
Well, even us as cleric, personally, one of the hardest things for me to do is to officiate or eulogize a funeral for someone that is younger than myself, and I consider myself a young man that's younger than myself, that have lost his or her life to an overdose. It's one of the most difficult things to do. I have a family that I'm meeting with this evening that I've been meeting with for the last 3 weeks because I recently buried their family member who again, died to overdose, and that's one of the most difficult meetings for me to do. Every time I have to sit with this family, it's one of the most painful. And by the time I get through and go home, I just want to be in a dark room because everything, the tears and the burden and the feelings and just being there, not knowing, not being able to give them anything that is concrete to hold on to mend that pain. So there's cost on every level. There's the financial aspect of it, there's the spiritual, the emotional, the mental, the physical aspect of it. There is a major burden where this is concerned. And I feel like the conversation needs to be, what do we do about this epidemic? I feel like that's what the conversation needs to be.
I hear that coming in through all of your answers, and this is something I had to sort of unlearn about addiction from the way I was brought up, where addiction carried a real stigma and that if you're addicted, there's something wrong with you. You're a bad person, you made bad decisions, you are in with the wrong crowd. And not that there was no compassion, but there was almost a sense of, well, you kind of deserve it. You did this to yourself. And when the way that we are currently treating it through the criminal justice system is sort of in line with that you're punishing someone for behavior rather than approaching it as a public health crisis, which you would address in a much different way. That yes, people, as you said, are doing bad things in order to acquire these drugs. So do we punish them for doing the bad things that they did to get the drugs, or do we try to work on, well, why do people take these drugs in the first place? Whether it's a coping mechanism, as some people would say, or something that's, different drugs have different levels of dependency, but something that's truly beyond people's control to handle on their own. I think that's something I didn't quite grasp either, is that once you're in the grip, particularly with heroin or some of these opioids, you don't just wake up and say, I'm going to stop today and, make a resolution and go cold turkey. There are physiological consequences. This is actually very dangerous to do that. And without the access to treatment programs and the resources to help people get off of these drugs, they're kind of between a rock and a hard place.
Well, let's look a little bit first at the prescription drugs that people ever so often get addicted to. I remember having a surgery maybe 7 years ago when I just came here. I was here for probably about a year. And I was given pain medication. Now, honestly, I don't even know what the name of it is right now. My wife would probably be able to tell me. But I remember taking 2 as prescribed the night when I got home. And I have to say the pain did not subside, but the high that I felt, the pain, I was almost numb to the pain. And I passed out a couple of times trying to get to the bathroom. And I remember my wife and I went back to my doctor, and I said to the doctor that, listen, I got so high. I've never been high a day in my life, and I got to a place where I didn't even know who I was. And the first question was asked is, do you want me to prescribe you some more? And I'm like, no, that's not what I'm saying.
I want to feel that way more.
You know what I mean? So that, I feel like, is a part of the problem. We have medical professionals who have no issue whatsoever writing these prescriptions for individuals because, someone may say, I need this. I'm sure there are alternative drugs to whatever the issues are. And then there is the issue of illicit drugs. I still am trying to figure out why is it so easily accessible, and that's where my struggle is.
Well, and some of what, in some of the conversations I've heard most recently, they sort of point a lot of the use of heroin to readily accessible prescription opioids. Oxys, the Percocets, and in two fashions. One, dental surgery. Here's a big bottle after you have your wisdom teeth out, or after sports-related injuries. That folks will be given more than is necessary, and no one will wait after the surgery, after the injury, to see, do you need it? And what happens is these meds the prescription will be filled. They may not be used by the person to whom they're prescribed. And so there'll be, I gather, I have young adult children, there'll be parties that folks will just bring, and there'll be a large bowl of opioids, right? And most of them were from somebody's prescription. Most of them weren't. And folks will just try this one or that and get a little high, and then you start taking a few more because they are so highly addictive, right? So there's that, even if it's not that you got a prescription and you used it and you used a little more than you needed, and you used a little more, and you went to the doctor and said, oh, I'm out. And the doctor said, well, are you still feeling any pain? You're going, yeah. Like when I stopped taking it, I'm really in pain.
Right.
Yeah, I was going to say that it's kind of, that I think so much, following up on what you were saying, Reverend John, is that there's, there is this message that's like, you made a bad choice. And so you don't want to talk about, people don't want to talk about addiction because the precursor to addiction must be, I made a series of bad choices. And I think one, I don't want to say there's something good coming out of this, but I think one good thing might be that the fact that this is coming from prescription drugs, which are, so value neutral, that there's more, regular people realizing that addiction is real and that it's not just people making stupid choices. And your story made me think of two things. One is, I don't know, like 15 years ago, I had surgery and I was just given, like you said, I was given this big bottle of Percocet, and I was in pain, I was taking it, and then it was time for me to stop taking it. And I found for myself that all I wanted was to take more Percocet. And I think I really don't have a very addictive personality, so I got totally freaked out by that. And I was like, okay. But it made me, like, I had to detox. I vomited from, getting off of it after taking.
And you were taking it as prescribed.
I was taking it as prescribed for a surgery, for pain that I was in. Like, I wasn't taking it for any other reason. And I was just like, okay, I don't want this experience. And afterwards, I think maybe it was, I was given it, I had my wisdom teeth removed, and afterwards I was so nauseated getting off of it. I had been eating Indian food because I couldn't chew anything. I couldn't eat Indian food for like a year after that because of the detox from the Percocet was so bad that I just started associating the Indian food with like feeling really ill. And then I have a good friend who, he was diagnosed with fibromyalgia, which is, like a, you feel like muscle spasms. It's a nasty thing. But he was given Oxycontin, and he also got addicted. And he's the father of 3 kids, and it was like he was just kind of out of it and taking it all the time. And I think part of what didn't happen, it wasn't just that people gave him too many pills, it was that no one told him, oh, this might happen to you. You need, if you start feeling this need to get more, like, let's talk about it, or these are the risks that you might experience, or this is support that you could have to get through this. And so he wound up basically being in detox, not realizing that was happening, and went to a physical therapist who said, oh, you're addicted. That's what's happening to you, is you're having detox. And so he had to get help. But I don't think most people would do that. He was only doing that because he was already seeing his physical therapist. So if you're just a regular person, you're given this stuff, you think you're doing the right thing by taking these pills, and then boom, you're addicted.
And I feel too that to go back to, it's a decision, you made a bad decision, or you're a bad person because you have an addiction. I feel too that there are those regular individuals who realize that this is a problem that I can't deal, because let us not forget that addiction is a disease that affects the brain and the behavior. Those are the 2 things and the body. Those are the 3 main things that addiction affect. And I feel like the stigma that comes with it will prevent any well-thinking person from reaching out to someone to say, listen, I have an issue. I find that I want Percocet or Oxycontin, or I need more than 2 bottles of 2 glasses of wine each time. I have an issue. Because immediately you're thinking, if I share this with Reverend Andre, he's gonna think something of me. If I share this with this person, without necessarily getting the kind of sympathy and help that is needed and required.
Or if the helping person is the person with, like, if any one of us were to think of the stigma and the fallout, and there's so many reasons why people don't reach out for help, particularly if they're a public figure, or if they're in a type of job where they would be judged, if it was made known that they had an addiction problem. That sure, you could be conscious that perhaps you have a problem. You may be told by family members that you have a problem, but like, I'm going to lose my career, and that's all part of because of how we think of addiction as this moral failing, in a sense, with the individual. The term regular people has come up a few times, and that fits in with it too. I remember as a kid when my parents would talk about, I shouldn't say my parents, it was really everybody in the little town in Indiana I grew up in, that drug addicts were like, they were people who, were homeless, and people who were just all these other things stacked on top, and that you'd be able to pick out a drug addict in a lineup pretty easily because of how they looked, perhaps the color of their skin, the clothing they were wearing, how they smelled, all these things. Boy, when I think of the people I've buried who have died they would not fit that description. Some of these people are from wealthy backgrounds, well educated, and come from not like broken homes, very supportive parents who've done everything they can possibly do to reach out, are part of a faith community, are employed, and none of those stereotypes have proven true.
Well, if you look at the Lynn Police Department statistics through July of this year, 46% of the overdoses were white men in Lynn. 23% white women. So, we are not talking sort of stereotypical drug-using gangbanger, right? This is not the profile our police department and emergency responders are seeing, and I just, so much of it, I think, is about how do we shift our perspective from one of judgment to how do we provide the resources as a community and particularly within the healthcare system. I mean, one of the things that the Kyami Mahanya, the medical director of the Lynn Community Health Center, has said is that he has fewer regulations on his ability to prescribe opioids than on his ability to prescribe medical alternatives that will get people off of opioids. And he says, you know, what is it? They will let me get them on. They don't necessarily, and there are all kinds of federal reasons, like, but.
Well, we can definitely agree that there are federal reasons and all of that. But then, crazy. But it is extremely crazy, and we also know that somebody benefits. We know that somebody benefits from the number of bodies that you and I put in the ground because of an overdose. Somebody benefits from that. The big company, the big guy, he benefits from that, and he controls the legislators. He controls the feds. We oftentimes think that it's just the people that we vote and put in offices that are making the decisions and the laws and the rules. They aren't really the ones that are doing that. They take their orders from the ones that are donating the 50 and the 60 and the $80 million to various campaigns and stuff like that. So somebody is benefiting. I mean, I remember growing up, I'm from a third world country, Jamaica, and it wasn't until a little late in my early adulthood that I realized that drug addiction is not just crack, cocaine, that kind of stuff. Like, there was prescription drug addiction. I had no knowledge or no idea of this. I just thought, well, somebody took some pills and something happened. Maybe it was a wrong pill that was prescribed. Because we're not taught this. And even today, my son has been going to school here. He started his pre-K, elementary, and now he's in middle school education here. And there are conversations when I sit with my 14-year-old child to have. These are not things that he's told in school. These are not things that he's taught about. So we have to go all the way back to the beginning of the issues in order to fix them. And that includes properly educating our children and providing information, useful and informed information for our children, healthy information for our children, in order to help them make certain decisions as they go along. Because oftentimes, too, addiction doesn't start when you're 19 or 16 or 15. Sometimes addiction starts at as early as 8 and 9 years old.
Well, and it also, and I think Massachusetts in the opiate crisis task force that has been gathered, they are dealing more with physicians and putting more controls on numbers of refills and numbers of days. And I will say my niece, who was putting her life at risk in a number of ways by biking without a helmet, and she hit a pothole and went over the handlebars. She was not wearing a helmet, so one can say wisely she put her arms out. She broke both arms, and so was double casted. And the student, she was in university, student health service gave her no painkillers, said, take Advil. And I was like, good for them. Now, she was less thrilled. She had double broken arms. But I think that was a response. I think a couple years ago, she would have been given a large bottle of Percocet.
Absolutely.
Take
it when you feel the pain.
And take it when you feel the pain. And, so I think there are changes. The place where I've heard there are fewer changes is with dentists, actually, because they aren't getting the same sort of regulatory scrutiny about the prescriptions. And, there's something about the advice of the medical community, which always seemed logical to me, and now I'm beginning to wonder how logical it is, which is you need to take the painkiller before you feel the pain. You need to stay ahead of the pain, right? Maybe not. Maybe not. Maybe we live so much in a culture that says physically and emotionally I should not be in pain. Right. That's part of, you were talking some about, sort of where are causes in the midst of this. There is a piece of our culture that says no pain. And if I'm feeling pain, I should take something to make it better. And certainly, if you're suffering from depression, there are meds that are not opioids that will make it better. But oh my golly, the number, particularly, speaking culturally, white men who self-prescribe because they're depressed, right? They won't go to a doctor to admit they're depressed. So they're taking some combination of uppers and alcohol to feel better, and then, by golly, they are addicted. So it sort of feeds in from so many angles, it seems to me.
I've heard that before, you stay ahead of the pain. I mean, I've had too many surgeries in my lifetime to not have heard that, And I often ask, and I still ask this question, what does that mean for someone like myself? How do I know when the pain is going to come on? So do I keep popping pills? Is that what you're saying to me? Because I'm trying to stay ahead of the pain. And then there is the issue of depression, and people do, what they think they need to do to cope with depression. We have so many people that go around today and diagnose themselves with depression and anxiety and bipolarism and all kinds of stuff that don't necessarily fit the criteria for these conditions. You might be going through a phase of something, but you're not depressed. However, if you seek the necessary medical help that you need, or psychological help, mental health that you need, you would find out that you're not depressed. This is what is happening, and this is how you get back to a state of normalcy. But then, as Reverend Jane says, again, you hear of addiction, you think black thugs, homeless, white trash kind of, but then these are wealthy, well-respected, well-established individuals who are self-diagnosing and self-treating with various kinds of stuff, and then creating greater issues.
I wanted to respond with two things. First of all, I think one thing that I feel a little uncomfortable about with something we've been saying is sort of that we're recognizing this problem because it's affecting white people, basically. And I do want to say that to me is, it's good that we're recognizing this problem, which is affecting all different people. But it is noteworthy to me how much more we notice a problem that's affecting white people. And, if it were, people that look like people who use drugs, who are using drugs, I think as a person of faith, that person is just as much a child of God who deserves for us to care about them too. And so I would hope that our noticing and being upset about addiction in this context wakes us up to a sense of compassion towards all different kinds of people, and isn't this is a different kind of problem.
Well,
in the 80s and 90s with...
Can I respond to this in just one really concrete way? Going back to what you said about mass incarceration, given Lynn's statistics about it overwhelmingly being white people where they're responding to overdose, our addicted prison population is overwhelmingly people of color. So if we want to get real about how we have disparities going on here, that's also an element that needs to be described. And who's
criminal.
Exactly.
Think of when you hear the word crack, what you think, which is the same substance in a lot of ways as cocaine, and the judgment and the way you think about somebody who's a crack addict versus somebody who's addicted to a prescription drug is very, very different. And the assumptions you make about how they became addicted and all of this.
But I think the other sort of shift that feels important to make is there is compassion, and we really do as a culture need to shift our approach to addiction so that we really address it head on as a public health crisis. I think you were the one, John, who used that language. Giving folks access to treatment, alternative sentencing for those who are arrested, where addiction treatment is really the proper response. But the other thing that is absolutely true, and I suspect we all know it in our congregations and the families with whom we work and worship week in, week out, is that someone who is addicted will do whatever they need to do to get the drug they need. And that includes stealing from their family, hurting their family. They may be put into treatment time and time again. They may make all kinds of promises to people they love about changes that they have made and what won't happen anymore or what they're doing to take care of themselves. And a lot of it simply won't be true, because what matters if you are addicted is your next drug. And it takes away the capacity within them to make what a non-addicted person, and I think this is part of the issue, the non-addicted person goes, they just need to choose not to do it. Addiction takes that away from people. And so, when we're looking at cost in communities of families and friends and workplaces, it's not about better willpower. And, families I love who love their kids have had to say, you may not come in my house. I will give you food. I will give you no money. You will have some, and you think about, oh, could I ever do that to my daughter or son? And the answer is, you darn well better if your kid is addicted, right? So I think we also have to be real, recognizing, because there are folks out there watching us today who are like, yeah, it is so easy for you all to sit there and talk about compassion for the addict. Do you know what it did to my kids' lives? Do you know what it did to my family?
It goes back to the because for those families, and there's this combination of grief and anger. And I think of times when someone's died and the person almost didn't know how to feel, because there's obviously the loss of someone they love dearly. They're angry at that person for what they put the family through and for what they put themselves through. And there's, even though it's not logical, and this is something that, it doesn't make sense unless you're, what could we have done differently? What could we have saved her? Could we have done something else to save him? And the answer to all those questions is, well, this is not something that mom and dad can sit down and fix. This is not something that even the church can fix. This is a health, to get off of heroin or an opioid, you need professional, and even then.
You may do the best supported detox in the world, and you may go down again.
Sure.
And I'm sure all of us have, I remember I was on vacation, my phone rang, and it was someone I knew struggled with addiction. And I answered my cell phone, and I could hear she was going down. And it was a call not to ask for help, but just to say, don't worry about me, I will be okay. And what was so clear was, not soon. And there was nothing, like literally I was standing in Vermont at Ben and Jerry's with my kids, and I just started crying, because even if I'd been there, like I knew I didn't need to rush back, there wasn't anything I was going to do to stop it in that moment. But I also knew that it was going to be one more time of going down and having to get clean again and having to start over. And, you know, and for families, that happens intimately again and again. And it is unbearable pain. And you're right, in the descriptions of the responses, it like the family you're meeting with, week by week, it's like, there aren't any right answers there. There's no way to fix it.
And the questions are there. What could I have done done differently? What more should I have done? And there is no answer. You know, there is no answer. And I learned, you know, through meeting with this family, I actually learned that because this family has suffered this tragedy not once but twice. It was a month before that they lost an in-law to the family to a drug overdose, and the young man that I eulogized, he just went into treatment, got out, and overdosed the day after he got out. And I learned that day, that when meeting with the family, that this is usually mostly when an overdose happens, right after they get out of treatment. And so it begs to ask, what do we do as a society? What do we do? Because you are absolutely right, John. This is a public health crisis. I feel like we are in a state of emergency where this is concerned. What do we do? How do we not just comfort the families of those that are addicted or are struggling with this disease, but how do we reach out to these individuals themselves and provide them with the help, and then stop the drainage, the bleeding that this causes to our communities?
Well, I think one thing is when people are already really hurting from the problem, I think one thing is to make spaces not enabling for them to do the drugs that they're doing, but spaces where we say we love you, because I think that is one of the biggest things that allows people to make different choices, is to know that they don't, you know, they're not condemned by everyone. Because, and that brings me back to what we were talking about earlier, is sort of, you know, there's so many different reasons why people would decide to take medication or drugs, and some of them are, you know, just someone gave you medication because you had dental surgery. But I think that there really also is a piece that is that people are walking around in pain. And one thing that I hope we can say today is, like, life is really hard. And I think that it's a lie that we tell ourselves on TV that they're like these perfectly happy families. It's just not true. Like, people are struggling, and I don't think that there's an easy way to make it okay. And yes, you can take an antidepressant if you're struggling with depression, but even if you take that, you're still not going to be okay if you don't do your work and continue, you know, and it's still going to be hard. And so I just think that, in a way, part of what I find so meaningful about being part of a community of faith is that we're having a hard time together. It's not that we got away from it being difficult, it's that we're leaning on each other through it being difficult. And I wish that could be that could be more accepted, that it's not that we have to escape our pain, it's that we have to, like, help each other through it. And sometimes it's nice and sometimes it's really hard.
Well, and it's help one another through it in the context of a faith community, in the context of a family, in the context of a primary care or behavioral health provider. Like, it is about speaking your pain.
Yes.
because I think so often we think that we're the one carrying this pain, that maybe we could or should do something about it ourselves, and if we were better or different, it wouldn't be so painful. And it really is, as you say, speaking that pain into community. And I think part of where that is maybe one of our hardest challenges is with elders, who statistically right now are the fastest growing of group of newly addicted. And the honest reality for most of them is that they are probably in some level of chronic physical pain, and they may be lonely, isolated, like life may be hard, and they don't necessarily have access to community. Family may not be around in the same ways. And I think that certainly as faith communities, we do need to think about how do we keep in touch. We need to work with groups like GLIS about how do we provide a network in our community that supports elders and helps folks work with their physicians to manage pain in ways that, you know, they aren't left with, oh, you've come to, I mean, what I'm watching these days is physicians who are saying to people, well, you've come to the end of what I can prescribe. And then the person is literally thrust into detox.
And I feel like a big chunk of that comes back to what you said earlier, that we operate in a culture that has told us and imposed upon us ever so often that we should not deal with pain. We should not feel pain. Life, and as Rabbi Marja said, life is hard, and life comes with pain every step of the way. Some kind of pain, be it physical, be it emotional, be it mental. Life comes with some amount of pain. And I feel like one of the things that we need to do, and we need to start doing as a faith community, is, I don't know how, I don't know what it is going to take, but get our people to a place where they accept that there's pain in life. You're going to have to deal with and go through pain in life. And not every pain can be numbed by something physical. Not every pain, you're going to have 15 or 18 people sitting with you to deal with it. Some pain, you're going to have to face it head on individually. But then there is a mental preparation to dealing with that pain.
And I think part of that is because, I mean, the phrase, I shouldn't feel pain, there's two ways of hearing that. There's the endurance part, you know, I don't want, but I should not feel pain because if I do feel pain, that means I'm weak. Or I should not feel pain because I'm a man. Or there's I don't want to, you know, here's where the getting ahead of the pain is actually maybe a good thing. If you have the freedom to say I need help, if you have the safety of a community where you can admit that I'm lonely. And this is particularly with elderly people, a generation, I don't know this for a fact, but perhaps the most reluctant to associate or may often associate depression or mental health with stigma versus something that is treatable and should not be seen as any different than diabetes or something like that. I have family members who, you know, probably should have gone to therapy, but would never ever admit that they were feeling depressed because to say I'm feeling this pain means that there's something wrong with me and I'm a weak man. Whereas if our communities of faith can create an environment that says life is hard, there is pain in life, and therefore it is okay to say I'm hurting right now, and to get in front of that with healthy coping mechanisms, and to have people, before it gets to the point where there's substance abuse, where you can have people who can be listening and compassionate and mental health care, addressing it before the pain becomes unbearable, in a sense. We only have a few minutes left. As far as final thoughts, I wonder if we might just say if there are people out there watching this who are either know they're in a bad place or know that they need some help or know somebody else who is in need of help, what are some next steps? This is terrible. There was a case in my congregation where somebody overdosed, and the friends that they were with at the time didn't call 911 because they were afraid they'd be arrested. And so there's sometimes a reluctance to reach out because of the way this is wrapped up in the criminal justice system, that if I get this person help, that means I'm going to get in trouble. So what do we say to folks who need help or know someone who needs help?
So one of the things that we, with this whole Jobs Not Jail coalition campaign that has already been launched, one of the things that we're trying to do is to get, for those offenders who have drug-related issues, rather than have them sent to prison or given time in prison, there is a program that they go through of some sort. I remember having to say to a family, not this one that I'm dealing with, but a family before that, they kept referring to the deceased as the addict. The addict. He was an addict. He is an addict. And I remember having to say to them a number of times, he's not an addict. He had an addiction. That's a condition. It's not who he is. And oftentimes that's what people need to understand. Having a condition does not define the person. And I feel like when we take that condition and label an individual or a community, we are inadvertently saying to them, this is who you are and you're no better. You will not rise any more above this. And for me, I feel like the message of hope is what at all times need to be conveyed. One, you're not a bad person because you are dealing with an addiction. You are not a terrible parent or family because you have someone who has an addiction or is struggling with addiction. Things happen in people's lives. People go through things. I personally do not believe that anybody gets up this Wednesday morning and decide, I'm gonna be an addict. I'm gonna get myself addicted to drugs or alcohol or any kind of substance. Things happen that get people to a certain place. People, one, we speak about being a community of faith. People need love. I learned earlier on in my pastorate that when I stand in the pulpit, people know that I can't pay your mortgage when I get through preaching. The message that I preach is not going to be able to take to the bank. People know that if you're sick, I can't physically heal you, but they look to us for hope. Whatever we say, the words that we use, it gives them hope to continue. And I feel like this needs to be our message, along with the other programs and stuff that we will somehow figure out something, get things going, put into place to assist people. But there need to be a sense of hope and restoration. We believe in forgiveness. We serve a God that believes in reclamation, and I feel like that needs to be our basis of operation at all times.
Yeah, I would underscore all of that, and I think also adding that it's not about assigning blame, either on the one who is addicted or on family members or friends. But it really is about believing deeply that as children of God, each of us is promised abundant life. And addiction takes that away. And it takes it away from the one who is addicted, and it takes it away from their family and friends. But really concretely, you will not be arrested. Call 911. Get trained using Narcan so that you can save your friend or family member, because if they don't live, they don't have another chance. If they live, there's always tomorrow. And use the resources of Lynn Community Health Center, Bridgewell, Project COPE. We've got a host of facilities and people ready to support those who want to change their lives. but know it's hard and impossible to do alone.
Thank you all. Amen to that. And on that note, we have to say farewell. Thank you for watching today. On behalf of our panel, it's a privilege to be in your home. And please know that we care and God bless you.